This chapter covers integumentary or skin diseases and disorders. In skin cancers, especially in concern for a melanoma, any change in the size, the shape, the color, the elevation, or any other appearance change in the lesion, um, such as bleeding, itching, crusting, uh, would be considered a danger sign. The ABCDEs of malignant melanoma is A is asymmetry. In other words, it's not the same on both sides. So if you were to um, look at one side versus the other, they're very different. B is border. Um, it has a border that isn't rounded. It may have looks like little notches, or may be kind of scalloped, or may look like it kind of runs the edges. C is color. It's uneven. It's not one color. It's generally a shade between tan, brown, black, or red, or white. And it's going to be a various points of shade of that color in it, or at least two or three of those. D is diameter, usually larger than 6 millimeters, and E is evolving. Guidelines to protect the skin: use a sunscreen with a sun protective factor, or SPF, of at least 15, and apply that 15 to 30 minutes before exposure, and again after you get wet, like if you go swimming. Avoid sunlight between the hours of 8 a.m. and 3 p.m., and when the UV rays are the strongest. Plan outdoor activities early morning, late afternoon, again when the sun is not that strong. Wear protective clothing, and especially wear a hat. We said the melanocytes are what give the skin its pigmentation or color. Um, so some abnormal pigmentation are several conditions where the colors or the sites develop abnormally, or are spread over the body abnormally or different. When the melanocytes are more numerous or more active, then there's darker skin involved that tends easily. And then abnormal pigmentation presents a cosmetic problem in some cases because of the irregularity of color. Albinism is an inherited condition. This is where the melanocytes don't produce any melanin. So there is basically, there's not really much skin color there. Patient is pale with white hair, generally a pink or pale blue eyes, and it's very distinctive. You see it in all races, um, and it's also seen with eye problems such as myopia, hyperopia, astigmatism, nystagmus, strabismus, or photophobia, which is a pretty good wide range of eye dysfunction. Vitiligo produces irregular patches of skin. So there'll be skin that's normal skin tone, and then patches that are a very different shade. And it usually is on one side of the body, but not always. And it usually follows a stressful event. It can be on any part of the body. It does not have a cure. They can change over time, uh, but generally it requires something like cosmetics to really to cover it. Melasma, when there's darker skin patches on the face, especially over the cheeks. You see this with hormonal changes such as during pregnancy, or with oral contraceptive use, and usually it disappears after the childbirth, or disappears after um, the oral contraceptives are no longer being used. Hemangiomas are benign lesions of developing blood vessels that create a lesion of red, blue, or purplish color. There's a nevus flammeus, is a dark red or purple. It's on, and usually on the face. There's a strawberry hemangioma, which is bright red and has rough edges, a rough surface. And then there's a cherry hemangioma, which is red to purple and is uh, a smooth dome-shaped small papule. Nevi is another name, or the actual term for a mole. It's small, dark areas of the skin with dense collections of the melanocytes. It can include a hair within it or hairs within it. Um, it One of the things with nevi is they can become malignant. This is the reason why we say whenever a mold changes is something that probably needs to be evaluated because of that potential. Pityriasis is a fungal infection. It causes flaky skin or light or dark skin on the trunk, and it's really not a common problem. Abnormal suntan, in this case, it is an adverse reaction from a medication um, or from a biological substance of some kind. Um, and it comes with also with certain people who take a particular drug that have certain diseases. So it kind of gives it a suntan appearance. Vitiligo can be treated with UV lamp treatments along with medication therapy. Pityriasis can be cured by antifungal ointments, and moles can be removed surgically. There's really not any treatment for moles other than that. And then laser surgery could be used for the hemangiomas because they are very vascular. Um,